Okay, so you want to know what are different things we're going to do on the day. So on that day, actually, we are going to have a detailed discussion. The first one will be why fibromyalgia happens, what are different reasons for it, and although people say we don't know any reason, there is usually a reason which need a lot of work to discover the cause. Quite often it's some sort of infection, some sort of physical trauma, some sort of emotional trauma, and that just triggers it and it happens. And depending on what the cause is, there are different types. And lots of people don't know it's like fibromyalgia is fibromyalgia. That's not the case. Fibromyalgia is of different types. It could be allodynia type, it could be hypersensitivity type, or there are different varieties. And based on that, because there is a mechanism for it, so what is the commonly said is it's increased sensitivity or central hypersensitivity, which is because of the increased neurotransmitters. Quite often there is something called substance P, and what happens is that substance P normally regulates the pain. Now what happens is that when there is excessive substance P, it opens the channels. So what happens normally, like pain is conveyed through some special type of nerve fibers. Now if it is increased substance P, it widens the channel too far, and therefore all the impulses are passed through the same channel. So if you put like say for example, if it is touch sensation, normally it should pass through a different channel, but because it is so wide, the touch is conveyed through the same channel. And you can imagine now, if you real life, so if you see in real life, if you touch that person, it will be going through the pain channel, and therefore touching will be perceived as pain. So there's in some way cross wiring of that. Same with pressure. So people who are trying to put clothes on, it looks like pain. It's something which can go to an extreme where there is real high pain sensitivity, then they can even go to the extent of burning. So that is part of that. Now recently there is also a lot of people have done the functional MRI, and there are certain areas of the brain which are lighted up there, and that is a different type, which is the autonomic type. And these are the people who actually present more with irritable bowel syndrome and headache rather than the other typical type of the muscle pain. Although the pain and the muscle pain and the tender spots, which used to be classically mentioned previously, are not so essential features. However, it's such a complex disease that people find it mixed up, and it's like catch all. For all, they just give different type of painkillers. Some people it works, some people it doesn't work. We don't know what the case is. So if we can tease out a different different types of or subtypes of this, we can find out which one would respond better to typical painkiller, which will respond better to like pregabalin or gabapentin, which will be better responding to even medical marijuana, which is now recently I found to be a better to pain responder, and some other respond very well to magnesium. And again, these are different subtypes, and there is different varieties. Some of them respond better to some dietary supplements, some will respond different to some undulation therapy, which is a recent type of therapy where you send micro vibrations through this, as a result of which the muscle fibers tend to relax. And this is the other variety. So I think the whole system of complex fibromyalgia will try to break down into small different types, and then people can work out what will be their subtype, and then we can help them developing what would be more appropriate for them, and then we can help them with coaching, with the medications, with these there are some undulation beds available there to help them to try, We will also give them the opportunity to have a detailed discussion in terms of what different concerns they have. So it's all you can. There is nothing like this existing. So we'll see what they feel like